And how do you work with all this emerging technology and the new stuff that doesn't have class or magic quadrant, the AI and the bots and all the technology that may help, but we don't know?
Thank you for joining this episode of the Elephant in Your Hospital podcast with Futura Healthcare. I'm Jessica Ballash, Director of Marketing at Futura, and today I'm joined by industry healthcare leaders Valere Lemon, Division Director of Clinical Informatics, and Wesley Jayroe, Director of Enterprise Applications, as well as Cyndi Cahill, who has over 30 years healthcare experience wearing multiple hats, including former CIO and former CHIME board member. In today's episode, we talk about vendor management, as well as managing contracts and the delivery of service. In our previous discussion, you had brought up scenarios where it might be difficult to ensure that you're receiving what's promised within a vendor contract and tracking down your escalation pathways. So, Val, if you wouldn't mind, can you explain how those also impact your projects and your teams?
Yeah. Service level agreements are really important, and being able to define those, as Wes said, sometimes sales teams are working with our COO or others that are not part of our department. Those contracts have been put in place where we were not really a part of that conversation and knowing what we need for support. So you're kind of working with a finished document that you didn't get to define. And that can cause barriers sometimes because what you think is critical and needs escalation may not be outlined that way in a service level agreement. So we just try to advocate for our teams, myself and my boss, our other division leader. We're pretty good, I think, about escalating and pushing back on vendors. And it's, sometimes you have situations where the vendor wants to do an implementation at a time where it's not a good idea for the clinical team and it's going to cause patient issues. And so trying to always be a part of those conversations, and sometimes we don't get our way, but I think it's really just a matter of being persistent and knowing what your abilities are, and then also feeding that information back to your COO or CNO, whoever is the one that's actually signing that contract, and making sure that they understand that in this project, we didn't have this type of service level agreement. It impacted us in this way. So in the future, can you make sure that we have this? And so it's really a lot of, I find in clinical informatics, because it is so new, because technology is just being implemented every day in every department, it's a constant learning process and a battle of, hey, this didn't go well this time, let's do it differently next time. And that might not go well either, but it's really just a matter of trial and error.
Yeah. Yep. Okay. How about you, Wes?
I'll be honest, I'm new at this process and reviewing statements of work. And so I'm starting to learn, you have to do your due diligence early on in the process. I think, basically your vendor is taking what you're saying you want to implement, and they're taking that back and giving their own interpretation of what you should implement. And it's making sure that the people that are reviewing that on your side have a clear understanding of what that contract is requiring you to do as the customer and what they're going to be responsible for. And so I think that's the biggest thing that I've learned is you need to factor that time in. I feel like a lot of times it's like, hey, we need to get this contract through. We need to get moving on this. Mm-hmm. But that contract is binding. And so I think it's worth the time to really do a deep review and understand with your legal team of what these things mean for you as an organization and what you can be held accountable to. I know I've heard before, if we have to go back to the SOW to figure out what we're going to deliver, then something's gone wrong.
Yeah.
But typically something does go wrong, and we've got to go back to the SOW to clarify, to say what they said they were going to deliver as part of that. And so I think that's my biggest takeaway, is really having a clear understanding of that and doing the due diligence early in the process before it's ever signed and you're in the execution phase.
Mm-hmm.
Having
I
been
think-
on, oh, I'm sorry.
I was
Having
just
been
going to
on-
say, Cyndi.
Having been on both sides of that table, I always found that the deeper the relationship was with the actual vendor or somebody on there, the easier it was to get something, done that wasn't done right or fixed that was. So I think that leads me to my question is, I assume you guys have preferred vendors that you work with. Does the contracts team or does somebody review that list every year or every 3 years or whatever to try and figure out if you're actually working with the right vendors?
From my perspective, it seems as though they're leaning heavily on us as the IT leaders to say, we vetted these partners and this is the ones that we want to use. So I would say in that case, they're leaning on us to give a recommendation.
Okay.
Yeah, I'm not sure if there's specific contract review processes, so I don't want to say yes or no in one way or the other. But they're the same as with Wes. We are constantly being asked how certain things are going, or if we're escalating consistent problems with a vendor, then I think they're more likely to look at switching out to a different one.
Okay. I wanted to go down some of the more financial challenges that I know has been plaguing healthcare in the last 3 years now, let's say. So we know many organizations are focusing on app rationalization to achieve some cost savings. So are either of your organizations doing something similar?
Yes. We are doing that on a daily basis, and that's part of creating that centralized funnel of all requests. And we never really had a formalized kind of vendor selection process where we can kind of scorecard things. And so that's something we're trying to implement right now.
Okay. Val?
It's similar to us, so I don't have anything super intuitive to add.
Okay, no worries. So Wes, with you having 2 hospitals, and I know you mentioned soon to be building another, Val, you having over 150, I imagine your processes, even if they're similar, they're probably playing out pretty differently. So how does your vendor selection process look like, or are you involved in it enough to kind of speak on that? Just curious from that perspective, if you are looking to partner with a new vendor, what does that look like? Are you part of those discussions? And like I said, it probably varies depending on what the solution is and what the instance is, but just anything that you might be able to shed on there.
Ours varies significantly. We have a lot of acquisitions of our hospitals, so they already have existing vendors in place. So we have multiple EHRs, multiple nurse call systems, a lot of different nurse communication tools like Vocera and Hillrom and Rolland, and we probably have them all. And I think over time, standardization is good. I would say that my boss and I love the idea of standardization because it makes it easier. If we're implementing one thing at a hospital, we know we can just implement it everywhere. But if you have multiple EHRs, you're trying to fit a workflow into one that you're doing from another that might not be perfect match. So that's a little bit challenging, but I think also having different vendors is good just for, contract processes. It makes you more competitive. It gives you bargaining power. So I think there's benefit in not having, I don't know if loyalty is the right word, to one specific vendor. There's pluses and minuses to every single one of them, where they might be the less expensive route, but their customer service or the response times might not be as great, but the technology is better. So you have to kind of weigh the, risk versus benefit in each of them.
Yeah. Yep.
Yeah, that's what we're trying to do is, assess When it comes to vendor selection, we really go out there and look at the industry and see, who's industry leading, look at and use data, class research, Gartner, Magic Quadrants. We try to use all of the resources at our disposal to really make the best decision, because we don't want to be switching vendors for things on a regular basis, because that adds to that provider burnout and things, because we're constantly changing things. And so and one of the big things I've noticed is we go out and ask other, pediatric specialty. We want, hospitals that are in our kind of niche that we can, work with and learn from. We've got different groups that we meet with on, a regular basis to kind of, just as health organizations in our space, that we talk about these things and like, hey, if you've worked with a vendor and it hasn't gone well, those things are going to come out in those conversations. And so it's a lot of word of mouth, but working with other orgs, see how they've, how their experiences have been, I think play a big role in some of the vendor selection that we do.
And how do you work with all this emerging technology and the new stuff that doesn't have class or magic quadrant, the AI and the bots and all the technology that may help, but we don't know? How do you work with that?
Yeah, that's a great question. That's on the docket currently. I think I got a communication and, there's over 15 that we want to look at for, conversational AI. There's so many to choose from. And that's where it's like you want to find which one is providing the best service. That's where, the service comes in, but also the relationship with your contact with those vendors and, your interactions with them play a role in that. But ultimately, it's picking the best solution for the long term, because I think some emerging technologies, they blow up, they get really popular, and then another one comes in a year and has completely surpassed them, and you haven't even implemented the tool yet.
Yeah.
So that's why we're trying to do a lot of due diligence in vendor selection in those emerging technologies, so that, we pick a good long-term vendor. We're not having to just turn around and scrap everything we did and go with a different one a year later.
Mm-hmm. Kind of reminds me of once COVID hit and telemedicine and, everyone implementing anything and everything at that point, and then having to kind of really figure out who was the long-term players with the telehealth technology. So
yes,
reference clients are also really important. I've worked on the vendor side as a product manager, and now in the hospital. I think it behooves both the vendor and the client to provide reference clients and to get that reference, because what works for one health system, where if it works for Wes at 2 hospitals, that's great. But if I'm implementing it across 180 hospitals, it might not work well because they don't have the bandwidth to implement quickly. Right. So then we're years behind. So you have to think about comparing yourself to an organization that is like you, and be very careful about that, because I think that's one quick way to get burned. Is it looks like a great tool, but then when it comes to implementation and support, do they really have the infrastructure to support your health system and what your needs are?
Great point.
Yep. Well, we're coming up on time here, so if there's nothing else that either of you wanted to add, I wanted to thank you both for taking the time to spend with us and share your experiences. You both are doing great work for your organization, so I appreciate it. And we look forward to future conversations with you, but definitely appreciate your time. Thank you for listening to today's episode. Be sure to subscribe to listen to future episodes of the Elephant in Your Hospital podcast, or visit our website at futuraworks.com/podcast.